Benzodiazepines are a class of medications that are used often for anxiety, for seizure disorders, and probably other things, right? Insomnia. Yeah, so we wanted to talk to you today as reproductive psychiatrists about our understanding of the use of benzodiazepines during pregnancy and their risks. My name is Dr. Nichelle Haynes.
I'm Dr. Kristen Lassiter.
And we're Medical Mamas. This is your place for evidence-based information about your reproductive mental health.
Meaning mental health in relation to your reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
So let's start with listing maybe a couple of common benzodiazepine medications.
That too. So benzodiazepines is a class of psychoactive medications that consists of several different types of medications. So the common ones are Lorazepam, which brand name is Ativan, Xanax, which
Alprazolam.
is Alprazolam.
Then we have Valium, which is Diazepam. And we have Clonazepam, which is Klonopin. We have Oxazepam, which is Xanax. Temazepam, which is Restoril. And then some of them also come in like XR or like long-acting form of that same thing.
Yeah.
I think those are like kind of the more common ones.
Yeah.
There are other ones that exist too. So those would also fit in these categories.
So in general, when they've kind of done research on these medications in pregnancy, they've kind of looked at the medication class as a whole rather than looking at each individual type of medication, although some studies have looked at each individual one. But so today we're going to talk about the risks of taking these medications in pregnancy, just kind of as a class, as a whole.
Right, and I think also just to add a little caveat that just because risks exist does not mean that it's not the right medication to utilize in certain circumstances. We're not here to say everyone needs a benzodiazepine. We're not here to say that they're right for everyone. We just want to provide information about the known risks of these medications so that people can make informed decisions about whether they're right for them and take this information to their physician. Of course, as always, you're not your physician, so please talk to your doctor if you have concerns about these things.
And making sure that you're weighing these risks of these medications with the risk of not using the medication, right? If you're using this medication to help you with sleep and you're not getting sleep without it, then that in itself has really some risky things that can happen during the pregnancy and postpartum. So just making sure that it's like kind of a well-rounded discussion.
Yeah, for sure.
The first risk that has kind of been talked about more commonly, I feel like, is that these medications can increase the risk of cleft lip and cleft palate in the baby. But in newer, more recent studies, that hasn't been shown consistently. So whether or not that's real is still out for discussion. But so that might be a possible increased risk. The second increased risk that might be there is a risk of miscarriage. This has been a little bit more consistent in the literature and so probably is associated with these medications. But the other thing we have to consider is that these were taken from large database studies, so they weren't able to go in and look at the indication for why they were taking the medication.
So important.
Which is so important because it might be, we know that anxiety and depression are also associated with a risk of miscarriage.
And also, to just add another piece of information there, is that we use benzodiazepines to assist in withdrawal from alcohol. So is it potentially that? We also use them for some seizure disorders. So it's difficult to really pinpoint, is it the medication or is it the indication?
Right. Similarly, is it because of the severity of the illness, right? So if somebody has mild anxiety or mild depression, they're less likely to be taking a benzodiazepine. So is it more that people with more severe illness, they're the ones with increased risk, or that's what the risk is from? So anyways, we just don't have that information yet.
Mm-hmm. So two other considerations we would think about are risk for preterm birth or stillbirth. And the data that we currently have does not support that is an increased risk when these medications are taken in early pregnancy. that those two things, stillbirth or preterm birth, might be risks when these medications are taken later in pregnancy, like towards the end of pregnancy. So that might be a risk. And then also, we do know that there is risk for a baby being small for their gestational age with exposure to these medications when they're taken earlier in pregnancy. So that may be something along the lines of like these medications might sort of disrupt or inhibit some of the, growth and development throughout the entire pregnancy, or growth of the placenta, or, some of these things which we have not found really great information about. So those risks do exist.
I will say, I think for most of these risks, it's a pretty small risk. And then it's not like if you take it, you are
definitely going
to have that issue, or even likely going to have that issue. It's just that it raises the overall risk above the general population.
Right. It's the same example that I had said before. You may have seen it in one of our other videos is, okay, when you walk down the street on a sunny day, there is a risk of falling, right? But when you walk down the street, when there's ice on the street, there's an increased risk of falling. Does it mean you're always going to fall? It doesn't mean you can't fall when it's a sunny day, right?
Right.
So that's my little example. I'm so proud that I came up with it. But that's the information that we have right now about those medications in pregnancy. So we hope that you could take this information and utilize it for your care if it is appropriate for you. Talk to your doctor. Thank you so much for being here. Please like, comment, subscribe. We'll see you soon.
Bye.